Hey everybody, Ryan McMahon here from my home office. As you know, I'm in a quarantine today. If the CDC guidance that just came through, I have been asymptomatic. I could have been released. I'll wait till that guidance gets updated, or I'll be back on Monday for our regular briefing in person at the On Center. But this is a tough week for us. Essentially, we're starting to get the caseloads from the holidays. The grim reality of the virus getting into nursing homes is playing out in a big way. And so there's no sugarcoating where we are with the fact that the virus, you never want anyone to get sick with this, but you really don't want your seniors to get sick with this, especially your seniors who have pre-existing conditions, and that's what's happened. So unfortunately, we have lost 6 neighbors over the last 24 hours. 2 folks in the hospitals, 2 female neighbors of ours in their 70s, both of them. We lost their fight. And then we had 4 residents in a nursing home pass away over the last 24 hours. So absolutely brutal stuff. Again, we think about these folks, their family members, and just we need to keep them in our prayers. When we look at overall with caseloads, we knew caseloads this week were going to start to press up with Thanksgiving. They have. Overall, right now, yesterday was slightly higher than our previous high. Today is our high. If you look at where they are compared to where they could have been, maybe we're in better shape than other communities right now. Actually, I know we are. But it's still too many cases. 7-day average, 4.9% positivity rate. We're doing a lot of testing to essentially test these positive rates to see if they're that high, making sure we get broad samples. We have multiple testing. We have the nasal swab test. We have the saliva test. We have antigen tests. We're using everything we have in our arsenal. So not only are we trying to have many tests in many parts of the community to test that, we have all different types of tests. For those of you who believe that certain tests find false positives more than not, we have lots of different tests that are all indicating the same thing, that the virus is here. It's here. It's more aggressive. And we need to deal with it right now. When we look at the hospital numbers, 177 in the hospital related to COVID. That's up 2 from yesterday. We have 29 in the ICU. So certainly up 2's better than where we have been going. We've been seeing that trend get higher and higher. We'll put out hospital capacity numbers overall. Yesterday we had 583 beds left in the community. So not a 911 situation right now, but overall, when you look at hospital capacity, we have more COVID-related hospital beds than we have throughout the pandemic. Looking at new cases, we've now had 11,323 cases since March 16th, 348 new cases. So Wednesdays and Thursdays are always our high days. We're now a full week from Thanksgiving. 3 to 5 days of incubation, you get a test, here come the negatives or positives. So it is our high day. Whether or not we see 300 cases a day or 400 cases a day, time will tell. Tomorrow it looks like we're going to be less than this, back in the range where we have been. So maybe we'll see a little spike with Thanksgiving, and then it will get back into the 200 range caseload where we've been. But certainly there's a direct correlation with the increased caseloads and the holiday. There's no question. When you look at the 348, the troubling trend here is for us is we have 43 senior facility cases. Even worse, 42 of these cases are residents. So this vaccine cannot come quick enough. We heard the governor talk about December 15th being the day that the state will get many of the first doses from the Pfizer vaccine. Certainly, we're going to work with our state partners to make sure that nursing home residents get the vaccine first, so that this trend and this loss of life trend comes to an end. That's the good news with this. The bad news is that this virus is in the buildings again. When we look on to what are we doing for as far as testing, symptomatic testing at the FSHAD will be Cayuga Medical moving forward. Upstate's going to beef up their testing at the fairgrounds. We will manage the Cayuga relationship at the FSHAD. Again, ongov.net/Cayuga Medical. Pre-register for a symptomatic test. So if you're symptomatic, you're going to the FSHAD, you can go to the fairgrounds. You can register at the fairgrounds through Upstate through their MyChart registration. If you're asymptomatic, we'll continue our testing at the on-center, but we're also going out into the community. Again, next week, we were out in the community this week. When you look at next Tuesday, Northeast Community Center on Holly Ave in the Holly Green neighborhood. Fayetteville Village Hall next Tuesday. Pre-register at covid19.ongov.net. I want to thank Mayor Mark Olson for his partnership with the testing site in Fayetteville. On Wednesday, we're going to be in our south side in the city at the Southside Innovation Center on South Salina Street for testing. And we will be in Camillus at Shove Park on Wednesday. Again, pre-register covid19.ongov.net. On Friday, I want to thank Supervisor Colleen Gunnup for her partnership. We will be at the Salina Town Hall for testing for the town of Salina on Friday. We're going out into the community, and testing is the big thing that your county government can do. I know everybody is frustrated with the increased cases. I know some people say more restrictions, some say less restrictions. We'll work with the state government on that, and hospitalizations will be what drives restrictions. I think that's where this is going. If you have capacity, there might be in your community and you've stabilized your positive rates, then certainly you'll probably be more in a yellow zone. But if you don't have hospital beds to treat your sick, there will be restrictions. And that's just the reality of this situation. If you can't treat your sick, you have a problem as a community. So I just think the way that we can stabilize the hospital situation and make it better is to do the things that work, especially with gatherings of any size at this point. There's risk to it, and I know this stinks, and we could use other words, but the reality is in our contact tracing, there's no denying gatherings are driving the cases at this point. Looking at our orange zone, yellow zone testing today, we had great numbers. I want to thank all of our partners in the schools, all of our volunteers, our county workforce who are working to make this happen. Let's look at the numbers today. Again, these will be reflected in our state data. Once we do this testing, we know their numbers because they're rapid tests. Then we put them into the Eclair system, and it gets registered with the state, and it will reflect in that data later. But 2,544 tests, 11 positives, 0.4% positivity rate in the schools. When you break it out to the students, a 0.1% positivity rate. Really, really great stuff. Again, schools have been a safe space. The data continues to reflect that. K through 8 specifically, even stronger. Again, good work there. I want to thank all of our partners. This instills confidence in the faculty, in the parents, helps us see if there's any trends that are happening, any of these hidden cases. When we look at where we are, it's about hospitalization rates. It's about protecting our vulnerable. We are really focusing in on seniors, making sure seniors have the services that they need, like we were in the beginning of the pandemic, whether it's help with our HEAP program for energy costs, rental assistance. Again, these are for anybody who's been impacted by the pandemic and it needs help now. We have rental assistance for you if you've lost your job or lost hours related to the pandemic. HEAP specifically for energy costs as we get to the winter, please reach out to us. If it's a meal that you need, that you're running into because you're scared to go outside, if you're a senior with underlying conditions. Again, this is going to be focused in the fourth quarter. We have the vaccine coming. How do we get there? How do we protect the people that need the most protection? What kind of partnerships can we enter into to make their lives easier so that they don't get sick with this virus? We know who this virus is brutal on. Again, a senior line, 218-1987. It's a 315-218-1987. Please call that if you need help. Anything that comes up, we'll try to get you the appropriate help that you can. So overall, as a county government, we are increasing our testing capacity for symptomatic, asymptomatic testing. We're working with the state of New York and the federal government related to vaccine distribution. With tracing, we've allotted even more people to Dr. Gupta to get a better turn time around the tracing. And hopefully what we're seeing is a Thanksgiving surge that's going to loosen up. Again, yesterday I think we had 288, today 348. Tomorrow it looks like it's going to be down 75 to 100 cases. We'll see if that holds out. So hopefully this is a temporary peak. The real number is our hospital number in making sure that we can treat our sick. What will happen is if this number gets too stressed, elective surgeries will stop. Then you have opportunities for more restrictions. If the number stabilizes, our caseloads stabilize, start to go down, you'll see hospital numbers go down, you'll see economic restrictions go down as well. So this is really up to us. I'm not here to skew the data anyway, one way or the other. There's some small positives. There's a lot of negatives in this. But the one positive is there is a vaccine, and we got to get there. And it's up to us how we get there and how many people are impacted in that process. So I will be back on Monday. Hopefully I don't have to do one of these over the next 72 hours. That would mean that at least things are going in the right direction and there are no emergencies. But I need everybody to kind of really hunker down. The gatherings need to stop. Use your best judgment. You're smart, but I'm in a quarantine because someone in my pod got sick. It's going to happen to anybody, and that's the reality of this at this point. So please keep in mind those who are sick in the ICU bed, those who have lost loved ones over the last week. It's been a brutal week, but we're going to get through this.